All right, guys. So the lecture we're going to take a little bit of a look at today deals with the topic of not homeostasis, hemostasis. I think I misspoke yesterday when I was introducing things for class, but the topic that we were discussing yesterday during lecture was hematopoiesis, so red blood cell formation or blood cell formation. Today we're going to talk about hemostasis, which is in hemostasis is blood clotting. So we're going to take a little bit of a look at that today. I went through and changed all the names for everything, so hopefully that will kind of take care of any of the misconceptions that I posed yesterday, and I will try to make sure that I note that in class tomorrow as well. So let's go ahead and take a look at this. So blood clotting, or the process of hemostasis, usually takes place within about 3 to 6 minutes in normal, healthy people. If it does not take place in that, then we wonder if somebody's got some sort of an issue or got a clotting factor problem. The clot is going to stay there in place until we can actually regenerate some of that endothelial tissue that will eventually then seal over that area. Once that is happened, the blood clot then actually is broken down and then kind of reabsorbed by the body. Okay. There's a couple different processes that have to happen here, but the main purpose for hemostasis or blood clotting is essentially just to stop the flow of blood. All right. Um, we don't want to bleed out. We don't want to lose all this precious blood that we have inside of our body. So this is the reason why this process needs to take place. So what happens here is when we have a resulting break in a blood vessel, that blood pouring out triggers this process. So hemostasis is triggered by a couple different kind of basic steps here. So there's 3 basic steps: vascular spasm, platelet plug, and then coagulation. So they're all triggered by that opening or the loss of blood through that opening. And usually that loss of blood through that opening creates a loss in pressure. And that's one of the reasons why the process gets triggered to start with. So let's take a little bit of a look at step one. So this is the vascular spasm event, right? So what happens here are the platelets start to release a hormone called serotonin. All right, serotonin is a muscle contractor, so it causes blood vessels or the muscles within the blood vessels to actually spasm or contract. All right, that spasming narrows this opening through which those platelets are now trying to pour out through, and causes essentially a decrease in loss. It will also then trigger an increase in pressure because we've caused these vessels to now get smaller. So that's the first step that takes place. So as these white blood cells or red blood cells, sorry, are making their way out through this opening, the platelets that are kind of transferred or kind of stationary inside of the blood vessel notice that there's an opening in there, and they also notice the drop in pressure. All right, so they trigger the release of that serotonin. It's also one of the things that can be given to people in the emergency room when they have a bleeding event. So if you watch any of those shows, kind of doctor shows on TV, I don't watch too many of them anymore, but they will probably talk about giving an injection of serotonin intramuscular or through intravenous to essentially start this process to happen. The next process that takes place then is platelet plug formation. So once we have the spasm event, now we need to plug this opening. So what'll happen here is the collagen fibers that have been exposed on the end of the opening actually become kind of sticky. The platelets start to stick to those fibers, and then they cling to them, and then more and more stick to them, and more cling to them till eventually we form this plug. Those anchor platelets continue to release more and more chemicals, causing more and more of these platelets to be attracted to the site, sort of like a magnet. Once those platelets kind of pile up, that results in our plug formation. And then hopefully at that point in time, we can then kind of stop this process from kind of making its way out. If anything breaks this plug in the meantime, then we would have to start the process all over again. So a lot of times when we have a platelet plug formed, if somebody kind of picks that off or it breaks off it's on its own, we can end up kind of with an issue kind of going on there. The third step then is what's referred to as coagulation. So there's a lot of things going on in here, and I want to try to simplify this as best I can. So essentially what happens here is the tissue that's been injured releases a hormone called tissue factor. That tissue factor then starts to kind of interact with a couple different processes here. So it interacts with those surface platelets. It also interacts with some vitamin K as well as the blood protein clotting factor that's made by the liver. What actually happens here then is for this process to start to kind of be broken down, we get kind of this fibrin clot in here. And that kind of is the end result until we can kind of start to make this process up. So the thrombin joins the fibrogen protein into long hair-like molecules. Right, so we end up with this kind of strainy or kind of strandy looking kind of clot. You might have noticed that if you've ever had a cut or a scab on your skin and you kind of picked it off, you'll notice that almost kind of looks like it has these threads within it, and that really is the clot itself. And this is really the end goal here, is to form this fibrin clot. Over time, the clot's going to try to retract or essentially start to tighten up. And the main purpose of that is to try to pull those ruptured edges of the blood vessel closer together so that we can try to heal them. It's the same situation when we have like a cut in the skin and we either introduce like staples to close it or introduce sutures, glue, anything that we try to do to try to pull that back together, because those edges, those margins of the injury will heal much better if we can get them closer together. But really what we're talking about here in this coagulation process is we're forming this fibrin clot. Again, if we pick this off or it gets destroyed or knocked away, then that fibrin clot can then kind of we have to start this process all over again. One of the things that a lot of times I see, especially in athletic training, is especially when somebody has a bloody nose. All right, we do everything we can to try to stop the bleeding. We either put plugs in their nose to try to soak up the blood that's coming out and hopefully start this process, or there's other things that you can do. You can introduce saline into the nose. You can introduce actually, one of the things that really works really well is Afrin, to vasoconstrictor. So we introduce that into the blood vessel, it will cause, or into the nose, it will cause the vessels within the nose to constrict even further. Problem is once we get it to stop, we would like this process to continue for a little bit of time, but usually wrestlers don't wait that long. They go below their nose, right? Out comes this big, long fibrin clot, and then we have kind of issues based off of that. You know what? Real quickly here, I'm going to look this up for you. Because there's lots of different things that we see out there in terms of kind of clots. This is one of the ones. This is the exact picture I was trying to look here for you guys. So this is, if you notice, it looks just very much like the branches within inside of the lung. So this is an individual who had a nosebleed or some sort of bleed in the upper portion of his respiratory tract, and then that clot made its way down into the lung and then solidified, it coagulated. And then they were able to remove it in one piece because they could grab the top portion of it and just kind of slide it out. It's not unheard of when wrestlers or anybody who has a nosebleed to blow their nose. They're not going to get something quite like this because usually we get it from the upper portion of the nasal passage, but it still looks like this. It's very thick, very fibrous, because that process has started. And then once they blow that out their nose, then we have to start all over again. Okay. But that's really kind of what's going on there in this process. This just kind of shows you the basic factors that take place in here. And really what I would kind of remember are a couple of these hormones. So we've got prothrombin and thrombin that kind of work together here. But really the basics of this are vascular spasm. That's the first thing that has to happen. We get a platelet plug. Once that platelet plug is formed, we have to have coagulation and we have to have the formation of a fibrin clot. That stops this kind of cycle here. If you guys kind of remember when we talked about positive versus negative feedback loops, this is a positive feedback loop because we essentially just want to get to this fibrin clot before we can kind of stop this process from taking place. If we don't get there, then the process doesn't stop. Okay. And these two videos, again, what I'll do is I'll post those like I normally have and kind of give them to you, but they show the basic process of hemostasis in a real quick couple of minute video for each one. There are cases where we get clots where we don't want them, though. So these are these undesirable clotting factors that happen. So we can get what's called a thrombus. So a thrombus is a clot in an unbroken blood vessel, but for some reason, the anchor platelets send out those chemical messengers and start the process of forming a clot. For some reason, there's no damage in the blood vessel, but the body thinks that it needs one. These can lead to really bad problems, especially if they end up in areas like in the heart, because they can block off blood flow specifically to the heart, and then the person would have a heart attack. The other things that we can have are what are referred to as embolies or emboluses. All right. The embolus, what will happen is it's simply a thrombus clot that broke away and now is freely traveling in the bloodstream. They a lot of times will get plugged later on in other areas of the body, specifically the brain or heart. The person could either have a stroke or have a heart attack resulting from them. Most often, these are the ones that kind of silently kill people. They end up with a thrombus, usually in a lower leg someplace, and then that thrombus breaks apart either while they're sleeping or if they stand up to move around, and then unfortunately that embolus moves to someplace else in the body and then travels. Okay. Bleeding disorders and other things we can have. So usually bleeding disorders are due to some sort of disorder of the liver. So obviously because of the hormones that are being produced by the liver that kind of help to start that process, they can be genetic. So you could have somebody with like sickle cell anemia, or they could have a specific blood clotting factor problem as well. Or they could have the lack of vitamin K. Vitamin K is important in that process if we look back at those slides, and we can end up with some issues with clotting factors. The other thing we can have is what's referred to as thrombocytopenia. Penia essentially is Latin for the lack of, or to lack. All right. So what we end up with here, these are individuals with platelet deficiencies, so they don't have enough platelets in their body. So these individuals, even with normal movement, a lot of times will end up with small blood vessels that can rupture and require some sort of medication and things to kind of fix it. Usually people with thrombocytopenia have to have some sort of blood transfusion fairly regularly because they don't create the platelets that they need. All right. Other ones we can have hemophilia. Hemophilia specifically is a hereditary disorder. And there are two different factors that go into hemophilia, as well as sickle cell. So we have to kind of be careful with that. And in this case, people with hemophilia essentially just are missing the normal clotting factors. You can have somebody who is homozygous, meaning they can contain both traits for hemophilia, and you can also have somebody who's heterozygous. Heterozygous individuals still produce some clotting factors, they just don't produce enough. All right. The treatment for this really are transfusions, specifically of fresh plasma, because we need those platelets, or injections of the clotting factors, the thrombin, and the other types of hormones that would help with that process. Okay. All right. So we'll try to stop there. Again, the big thing from this one is those 3 steps. Just kind of remember the basics of those 3 steps. You don't need the whole thing of the last one. So just kind of take a look at those. If specifically we're going to ask a question about hormones, I will make sure that I include that in kind of the review guide here towards the end. So hopefully that'll kind of clear some of that up, and I will